Good afternoon, MPS Management Group. This is John Claudio Planzo. Thank you for joining me this afternoon for a few minutes to discuss our new employee benefits program that we're launching June 1st. Hey guys, I did want to just take a moment. I know that we have this listed as an MPS management presentation, but as you know, there are several entities associated with the group, and so your entity certainly falls under MPS management. Also, I do want to outline that this presentation is for all of our non-Colorado locations. So if you are tuned into this webinar and you are in the Colorado area or at one of our Colorado locations, please refer to the Colorado presentation that has some specifics with Colorado plans for you. This, again, is for all of our other entities outside the state of Colorado. All right, thanks, guys. Thanks, guys, for joining me. Once again, my name is John Claudio Planzo. I've been working with your leadership team to come up with a program that will work for the company nationally, and I'm happy to announce to you that we will begin to partner with Anthem of Colorado starting June 1st, 2019. The good news for those of you that are outside of the state of Colorado is that Anthem actually has a PPO network that works across the country. So you'll be able to enroll in either our bronze or silver plan, depending on your needs. And today we're going to talk about the differences between the two plans. Now, I will say I am happy that we're partnering with Anthem. Anthem, as you know, is a subsidiary of Blue Cross and Blue Shield, which, guys, I can tell you, I work with all of the different insurance carriers in the country, and by far Blue Cross Blue Shield is my favorite. I think that they do the best job with the network. I think they do a great job with their coverage for you as members. I can just tell you, in my experience, they're a very member-centric organization. So I am glad that we're partnering with Anthem of Colorado for your plans. All right, I'll try to keep this short and sweet. Forgive me, there is a lot of information for us to cover, so I want to do a good job of letting you know how everything works, and I will give you my contact information, so if you have any questions, feel free to call myself or Jackie, your account manager, and I'll put that on the screen here in just a little bit. All right, so let's jump right in. So as you can see on the screen, you actually have two plan options to choose from. One of them is our PPO HSA 28E, and the other is our PPO BC 28. What I want to do today is try to explain the primary differences, and there are quite some significant differences between the two, and the reason why we decided to offer two different plans to you, okay? The first one, guys, I'm sure is popping out at you, is an HSA plan, okay? So as you go through the plan, you can actually see that all of the items, like if I need to go to a primary care doctor, or if I need to go see a specialist, or if I need blood work or an x-ray, you can see everything is subject to the deductible on this plan, okay? And I want you to know that that's by design, okay? This type of plan, an HSA plan, that is how these plans are designed, is that everything is subject to the deductible, you can see, okay? Now, the key component to this is that you can participate in a health savings account. And so in addition to your premiums here at the bottom, which we're going to talk about, you can put additional money into a health savings account on a pre-tax basis, okay? And so the good thing about that for you is that the whole spirit of the plan is to pay the lowest premiums possible so that hopefully you can put a little bit away in your HSA. And then should the day come that you do need to use the plan, that you have some health savings account dollars saved up to help you with those expenses. And the key for you is that you can put them away on a pre-tax basis in your health savings account. That's really the strength of an HSA, okay? Now, you guys may have heard, well, John Claudio, isn't that the use it or lose it program? Not an HSA, okay? An FSA, yes, a flexible spending account is a program that is subject to use it or lose it. But a health savings account, that is your funds for your entire life. You and your family members can use it without ever having fear of losing it. It's your money forever. Okay, so a couple of reasons that you may choose an HSA plan is A, to have access to the health savings account like we talked about. And B, of course, we all know that health insurance in our country is very expensive. So it's also one of the lower cost options available for families and dependents. So I will share with you that I personally have a health savings account plan for me and my family. And there's a couple of reasons why I do that. A, of course, the cost for our monthly budgeting, right? It's the lowest cost health insurance you can buy. And I will say that my family and I were very lucky that we're fairly healthy, so I don't really have any predicted health care expenses that are coming, okay? So that might be something that you think about for you and your family. And then, again, even though there's so many things that are subject to the deductible, I do want you to know that you are receiving the Anthem Blue Cross Blue Shield discount for all of those services. So I'll tell you guys, the two reasons that you really should have health insurance is A, for network discount, okay? So if you go to a primary care physician without insurance, chances are that primary care physician is going to charge $100 to see you, okay, 100, 120. But when you have insurance, that cost is usually cut in half. So the negotiated cost with Blue Cross Blue Shield will be half, $50, $60. And so that is the amount that you pay towards your deductible, is the negotiated amount of, let's say, $50, for example, okay? So that's one reason, is to have negotiated discounts. The second reason is that max out of pocket, okay? Because once you pay your deductible on this plan, which I know $6,350 is a lot of money, for sure, guys. But if you're in the hospital for a month and the bill is $1 million, that's all you're going to pay. That's the maximum you pay out of pocket is $6,350. After that, Blue Cross pays 100%. So to me, the network discounts and having the max out-of-pocket protection are the two reasons why you should buy health insurance, okay? You'll notice that once you meet your deductible, you don't pay anything afterwards, which is a little bit different from our copay plan, right? Once you pay the $5,000 deductible, you do have 30% that you have to pay. But on our copay plan, guys, and we're going to talk about this, you have copays for services. So we'll get to that, but let me wrap up on the HSA and we'll discuss that. So these numbers to the right, guys, you're probably wondering, these are for family members, okay? So it would take two of you in a family to hit the deductible, to hit the family deductible. As a family, the maximum you pay, you, your wife, and all your children, if they're enrolled, is $6,350 each, to a maximum of $12,700 as a family. So that's pretty good protection, Heaven forbid something happens and two of you end up in the hospital for the year. Your worst case scenario is $12,700, which I know is a lot of money, again, but you can make payments on $12,700 where if you owe the hospital $1 million, that's going to be much more difficult on you financially, okay? All right, so a couple of things I just want to point out. Even though the HSA, like we talked about, everything is subject to the deductible, there is one thing that is not, and that is your preventive care, okay? So this is great for me and my family because we usually only use our once-a-year preventive care visit, and I really encourage you guys to do that. It's really critical for you to get in the habit of going to get your routine physical, ladies, your well woman's exams, and of course, guys, for your children, their well child exams and immunizations, right? All of that is covered 100% on any of our plans. And the spirit behind that is we want you to go and get your preventive care taken care of. We don't want cost to be an issue for you to do that. And plus, the more important reason why is that if you go to do those things, you can catch potentially lethal conditions before they get out of control, okay? So, for example, I can tell you I recently had a gentleman who had no idea that his heart was 97, had all his arteries going into his heart and his vessels going into his heart. He had 97% blockage. Felt healthy. He didn't know anything was wrong, but luckily he went for his routine exam and discovered this problem. Turned out he needed triple bypass surgery, and that was all because he went for his preventive care visit. Little did he know he was days away potentially, or, you never know, of having a heart attack and not living. So the reason I share this with you guys, take advantage of it. It's no cost to you, and more importantly, you'll make sure that you and your family are healthy by going to get your preventive care. So even on our HSA plan, those items are free. You do not have to worry about the deductible, okay? Now, our PPOs do let you go out of network, so that's what this is down at the bottom. I don't necessarily encourage you to go out of network. I actually recommend you do everything you can to stay in network, because when you go out of network, guys, you can see the deductible is very high, okay? So if you do go out of network for coverage, you are subject to a much higher deductible, and then I must share with you that you can be balance billed from that doctor. When you go out of network, you are not protected by that contract that is in network, okay? So just remember that. Down at the bottom, everybody, are your weekly costs, okay? So for some of our facilities, we pay weekly, and for some of our facilities, we pay biweekly. These are the costs to you per check. So for example, if you wanted the HSA employee only, just for yourself, the cost is $40.67 a check weekly. If you're paid biweekly, it's $81.34 a check, okay? I do have to let you know that, as you guys know, we are launching this as a new program with Anthem, and so these rates are preliminary. We really have to see what the final rates will be before our final installation. If anything changes, we will definitely let you know. Okay, so I do hope that you'll consider enrolling, and that will help the group. As a group as well. These numbers, guys, I do want you to know, are after your organization is paying half of your health insurance premiums. So I do want to let you know the company is making a significant investment in your health care by covering half the cost for you. So imagine this $40 is after MPS and its affiliates are covering half of the cost for you. Okay? All right, let's move on to the copay plan really quick. So the copay plan, guys, this is a more traditional plan, okay? Yes, we have a deductible. Yes, we have a percentage after the deductible we're responsible for. We still have the protection of the max out-of-pocket, which is good, but look at the major differences. We have copays for prescriptions. So, for example, it's a $15 copay for generic medications, or a $50 or $70 copay for brand name medications. It really depends on the prescription you need. And then we also have copays for for primary doctor, specialist, even e-services. So you can even talk to a doctor over the phone and receive a $30 copay. So you see the difference now. You don't have to worry about the negotiated rate. You know exactly what your cost is going to be. So we have copays for doctors, and we also have a copay for walk-in clinics and urgent care clinics on our copay plan. You can see those are different on the HSA. You have to still pay the deductible on the HSA. All right, so that's one major difference. That's really the one major difference why you would choose between the two. Okay? We still have out-of-network on the PPO, but again, try to stay in network whenever you can. And of course, we still have our preventive care covered at 100%. All right. One thing I wanted to show you, since I'm telling you how important it is to stay in network, I want to show you how to look up in-network providers. So the way you do that, guys, you go to anthem.com, okay, and under individuals and families, you're going to click Find a Doctor. Okay, from here, now once I do get you your ID cards, it's really good for you to register as a member, okay? It's really good for you to get in here, look at your claims, make sure everything's getting processed correctly. I kind of call this, you know, checking your receipt. Just like you check your receipt when you leave the doctor's or when you leave the grocery store, you want to check your receipt when you leave the doctor. And here you can make sure once you log in that you can check your claims and everything. But for now, we're just going to search as a guest. And so we're going to come here to search by selecting a plan or network. Okay. And then here we're going to select the type of care, medical. For this example, actually, let's look out of state. Okay, I know we have some locations in South Carolina, might be a good example. Okay, and once you choose the state, then we choose the network, okay? And our PPO network is actually the National PPO Blue Card PPO, and you click Continue. Now from here you can look for doctors, medical professionals. In this case, I'll look for a family doctor, general practice. And what I have found is the easiest to do is to actually put in your county. So in this example, we'll use Greenville County, South Carolina. And when you click search, it's going to bring all the participating providers within 20 miles of Greenville County, for example, the participating providers in the network, okay? Now, and here you can get great information. There's reviews, address, and so on and so forth. But if you see their name, then you know they are participating in the plan, okay? You can see doctor in network, all right? So I hope that helps you. I hope it helps you with that. All right. So those are our medical plans, and again, I'll put my contact information up at the end for any questions that you might have. Next, I did want to let you know that we are also offering dental and vision plans if you're interested. These are also national PPOs that work across the country. And you can see the way these plans work is, for example, if you do need to, you can see it's covered by a percentage, okay? So for example, my cleanings, my routine x-rays, those are going to be covered 100% if I stay in network. If I need a filling, for example, it'll cover it at 80%. Or if I need a crown or anything major, it'll cover those services at 50%. Now, for basic and major services, we do have a $50 deductible. So just to let you know, there is a small deductible for your basic and major services, but not your preventive. Now, just a reminder, you can go in network or you can go out of network, but I do recommend that you stay in network because remember, guys, just like the medical, if you stay in network, the dentist must follow the negotiated rates in network. If you go out of network, they can balance bill you. So, for example, Mutual of Omaha will pay 100% of a cleaning that they feel is reasonable and customary, but if your dentist charges more, your dentist can balance bill you for those differences. But it shouldn't be a big difference either way. And it is nice knowing that you can go to any dentist that you would like. So you have the freedom of going in network or going out of network, whichever you prefer. All right. Now the costs for the plans are down here at the bottom. So you can see again our weekly costs are here. It's $8.08 per check for yourself, or you can enroll your spouse, children, or family. And we did have one good question come up that was, hey, if I want to take employee-only medical, can I put my family on dental and vision? Yes, you can, okay? So you would take employee-only medical, and then maybe you would select employee spouse dental, employee child dental, whichever you prefer. You can mix and match it. The only thing is you do have to be enrolled. Okay, so the only way your family can get access to the plan is if you enroll as the employee. And then down below here are our biweekly numbers. Again, we're just doubling the weekly numbers here, depending on how you get paid at your facility. Okay, and last but not least, we have a vision plan that we're introducing. And guys, I think the vision plan is fantastic. If you wear glasses or contact lenses, I think it's well worth the money. Just the exam discount you get alone is great. You pay $10 for your exam, and that alone pays for the plan, in my opinion. You know, then you get a $150 allowance for glasses or contact lenses, and even if you go over that, you get 20% off the balance. So even if you're looking at a $200 pair, you're going to get 20% off that balance of $50 that's left over after your $150. So right there again, the plan pays for itself. For single, bifocal, trifocal lenses, you just pay a $25 copay. And again, you can use that allowance for contact lenses if you would like. Now, you can go out of network with the vision plan if you would like, but I do have to warn you, it only pays up to a certain amount. So, for example, for your exam, it's going to pay up to $37 for your exam. You can go once every 12 months for your exam, once every 24 months for your frames, and you can go once every 12 months for your lenses as well. And just so that you know, this does start when you used it, okay? So if you decide to use the plan in July, your 12 months, the next time you can get an exam is the following July. It rolls on a 12-month rolling calendar, okay? Down at the bottom, same thing, guys. Weekly 52, biweekly 26. Here are the costs, and again, very inexpensive. And so you can enroll, again, your family or yourself. If you feel that that is something that's good for you and your family, you can mix and match this however you would like, okay? All right, the rest of your kit, guys, has a lot of plan details, further details than what I've provided you on those summaries, okay? So if you do want to dig through here and read any more of the additional details, it is all in here for you. Even your medical plan's detailed summary of benefits and coverage is in here. On the very last page, guys, is my contact information and Jackie. If you have any questions, please feel free to reach out to us. We are here for you to help you with any questions that you might have. All right? I did want to point out as a couple of neat diagrams that I thought were helpful to remember how things work on the medical plans. Remember, you have your deductible that you must meet. That's step one, right? And not everything on our copay plans has a deductible. Remember, we still have some copays on the copay plan. Once you meet your deductible, the plan and you may share in the expense. This is the coinsurance. But again, the most important element is right when you hit that max, okay? After you hit that max out of pocket, Blue Cross pays the rest. So that is, well, was one neat diagram that I thought did a good job outlining that, okay? Let me show you one more thing, actually, too. As far as looking up dentists, the website is mutualofomaha.com, and you actually type in /dental, and it'll bring you to this page where you'll click the Visit the Member web portal. And here, very easy, guys, you can put in a zip code, 29644, for example, and click Search, and it will provide all of the participating dentists on our dental plan. Okay, so very easy to use, very easy to find dentists that participate. And then same with the vision, okay, mutualofomaha.com /vision. You'll come here and you'll click at the bottom, View My Vision Benefits. And down here, you can see the provider locator. And same thing, you can look up zip codes and you can easily find participating vision providers in the area. So very easy to use for the vision as well. Okay? All right, guys, I think that is all the information I have for you. If you have any, oh, excuse me, I'm sorry, one more thing, everybody. Your homework, the most important part. All right, we also have the enrollment form that we are asking that you please turn in by May 15th, okay? If you could please, anyone who is full-time working 30 hours a week or more, you are eligible for our benefits. Please let us know what you would like to do. And for those of you who are on our Friday health plan today, we do need you to complete this to enroll in the new Blue Cross Blue Shield plan starting June 1st, okay? So please, guys, fill this out as legibly as possible. We are literally going to be taking this information off of this enrollment form and putting it in the Blue Cross system. Please give me all your information in Part 1. If you are enrolling any of your family members, please let us know in Part 2, all of the family members you plan to enroll. And don't forget, you can mix and match it, right? So if you want to enroll yourself in medical, you would check off medical. But let's say you want to enroll your spouse and maybe your children in dental and vision. Well, you'll put them there and you're going to enroll them in dental and vision, okay? And you'll enroll in dental and vision as well. So this is just a really clear way for us to know exactly what you would like to enroll in, okay? Page 2, kind of the same thing. You're letting me know what you would like to do. Now, for those of you who are declining coverage, please, guys, let us know that you're waiving coverage. We want to make sure we know exactly what you need to do. So even if you are full-time and waiving, we do need this sheet from you, okay? Let us know. If you're waiving coverage, that's okay. If you're enrolling coverage, just check off which plan you'd like to enroll in. Maybe you'd like to do employee spouse dental and family vision. That's okay. And in section 6, let us know what you want to waive. Okay, be sure to fill this out if you're waiving any coverage. And then last but not least, everybody, you're just going to sign the very end. Super easy, okay? Sign the end and date it, and that is all that we need back from you by May 15th, please. Okay? All right, guys, with that, I will leave my information on the screen. If you have any questions, please do not hesitate to contact us, and we'll be happy to help. Thank you again for your time, and congratulations on your new benefits.